to say a very good morning to you. And if you are joining us here on CCFm, you will be also able to watch this on Facebook and YouTube, because this morning we're chatting to two amazing people, Sister Maxine and Jacques Smith, a nursing standards manager at Life Kingsbury Hospital. Sister Maxine is the unit manager for Acacia ward at Life Vincent Pallotti Hospital. It's International Nurses Day. Good morning, Maxine. How are you this morning?
Good morning. I'm well, thank you. And yourself?
Very well, thank you. And Jacques, thank you so much for your time this morning, sir.
Thank you so much for having me. How are you doing?
Great. So celebrating its nurses with the theme, A Voice to Lead, Life Vincent Pallotti and Life Kingsbury Hospitals proudly acknowledges its nurses who are at the core of patient care and are often the unsung heroes of the healthcare industry in South Africa. The Life Healthcare Group employ as many as 10,000 nurses across the country and celebrates them for being at the heart of patient-centered care, leading nurse care and using their voice to consistently drive improved healthcare services and systems. From Life Vincent Pallotti Hospital in Pinelands, we have Sister Maxine, the unit manager of Acacia ward and COVID-19 positive ward, as well as from Life Kingsbury Hospital in Claremont, we have Mr. Jacques Smith, a nursing standards manager. Briefly tell us, please, Maxine, what is International Nurses Day and why do we celebrate it?
I think for most of us, or all nurses, the name Florence Nightingale comes to mind today. International Nurses Day is basically a birthday, and we as nurses get to celebrate annually on the 12th of May her birthday. We all know that Florence Nightingale was a matriarch of nursing. She was our hero. The pioneering work that she did still impacts the nursing profession up to today. This is also a day where we as nurses celebrate our passion for people, the quality nursing care that we deliver on a daily basis, and our core values as nurses. It's also a day where we get to reflect on where we've come from as a nursing profession, where we at and where we're going. And the most exciting part for me is we get to celebrate each other.
I love that. And then, Jacques, a question for you this morning. What inspired you to become a nurse?
So I've got a bit of a different story, I would say. So I finished school and my plan was to upgrade my matric results. So I took a gap year. And, it's during that year that my grandmother became ill and I ended up taking care of her for that year. And it's in that year that my passion and, the spark came for caring for other people. So, and then I ended up doing my degree for undergrad nursing. And during that time period when I was doing my degree, I was exposed to so many facets about the nursing profession, all the different disciplines, all the things, all the areas nurses could be employed in. So that was one of the things. And then I have one night I went out for dinner. This is, after completing my studies, I went out for dinner and the waitress came up to me and she was very, very excited. And I didn't understand why she was so excited, only to, as time went by, she asked me who I was, do I remember? And I was very cautious and I was going to answer that question. Anyway, she then proceeded to tell me a little story, and then she said I was the one that actually delivered a baby, and she was so excited about that. And then she showed me pictures of a 2-year-old daughter, and she even made a joke to see, look, see your child. So it's always about, people won't always remember what you did for them, but they'll always remember how you made them feel. And in that moment, I realized that, I made an impact on somebody to make her feel special in a vulnerable state. And for me, that was very special.
That is very special. Jacques, there are various challenges, everything from the COVID pandemic to other things that nurses face on a daily basis. You go into those situations and those times when it's really difficult. But to highlight for us, general public, what are some of the biggest challenges that nurses face?
So there are quite a number of challenges, but I'm just going to touch on a few. Obviously, the first one being the pandemic, which put a lot of pressure on our health system, especially particularly on nurses, both mentally, emotionally, and physically. So it was quite taxing, and a lot of pressure in terms of saving lives. Not having enough bed spaces in some facilities. Um, However, within Life Healthcare, there was employee wellness that supported our nursing staff to deal with a lot of those stresses that need to deal with. Then we also have the nursing education and training currently within South Africa. There were recent changes in the nursing qualifications from the South African Nursing Council, where there was a bit of a halt in nursing education in terms of nurses couldn't apply to further their education and training. Most nursing education institutions at the time were, awaiting accreditation. But because they aligned the national qualifications framework, it impacted, all nursing qualification. So the stakeholders included the Council of Higher Education, and then this became a big focus area for nurses, where going forward, you could see there was a lot of people, wanting to develop themselves, self-improvement, and to better their skills in terms of, being able to care for patients better. And then we also look at, within Life Healthcare, we've got development programs such as our short learning programs in terms of, if you wanted to become an infection control nurse, if you would like to specialize in trauma nursing as well as neonatal intensive care, as well as high care or ICU.
Brilliant.
Another issue.
Sorry,
Yes.
we just got to cap that a little bit shorter there. We're running out of time a little bit there, Jacques. Sorry to interrupt you.
No problem.
Sister Maxine, wanted to just quickly ask you very briefly if you could just highlight some of the challenges that you as a sister experienced during the pandemic, please.
Okay, so as the COVID manager of Life Vincent Pallotti Hospital, the most challenging aspect of the pandemic for us was navigating through the first few waves, the uncertainty each COVID wave brought us. Just when you thought, I remember just when you thought you knew the disease profile of COVID, a new variant would come out, a new wave would hit us, and the patient's profiling would change completely. That was so challenging. However, with our COVID infection control policies that are now standard, we got some experience on how to handle the influx of COVID patients within the hospital. I remember thinking when I started my nursing career 11 years ago, nothing in my education journey would have prepared me for the pandemic, any of us.
Sure.
However, what it has also taught me is that we are resourceful, we are capable, we are tenacious as a nursing community and as a country in a whole. And that's something I'm very proud of. We definitely had to learn new nursing techniques because this was a novel virus and it was a very complex. Um, it was very complex to navigate. It was a challenging environment. It was dynamic and ever changing, and we had to adjust with that environment. But in the end, we all found common ground. In the end, we all fought a good fight. It brought the medical and the nursing profession close together. We got a better understanding of each other. Our respect for each other grew, and we definitely appreciate each other more.
Sure. I love that. Well done. Well done. If you've just joined the conversation, we're chatting to Jacques Smith. He is a nursing standards manager at Life Kingsbury Hospital, and also Sister Maxine McNamara. She's the unit manager for Acacia ward at Life Vincent Pallotti Hospital, also the COVID ward. And as we wrap up this morning, I'd like to ask you, Jacques, just Maxine, one last question. As the general public, how can we show our appreciation to nurses, particularly today being International Nurses Day?
Well, I would say if you have a family member that's a nurse today, a loved one, a wife, a sister, a brother, a neighbor, just pop them a message of appreciation. Just say to them that you value the work that they're doing. I know that meant a lot for me today when my loved ones did that. And
Yeah.
also, just for the broader community, let's just be aware that COVID is still out there. Let's just respect each other and adhere to the protocols and systems that are still in place there to protect us and our communities. And also, if you have a loved one that's in hospital today and you're going to visit them today, just say a kind word to the nurses. Just appreciate them. I know it would mean a lot to them. Thank you so much.
Thank you so much. Jacques, Maxine, absolutely such an honor and a privilege to chat to the two of you this morning. Thank you for making time in your busy schedules. And our thoughts and our prayers are with you and every single nurse across our beautiful country. Thank you so much for the incredible work that you guys do. And we really want to encourage more people to study nursing and to get into that sphere because it is such a vital role to play within healthcare and the well-being of patients. Thank you, thank you, thank you so much.
Thank you so
Thank
much.
you,
Thank
Jonathan.
you.
Thank you very much.
Really appreciate it. Take care and enjoy International Nurses Day.
Thank you.
Thank you. Thanks for the opportunity. Thanks. Bye.
Bye-bye.